Hey guys, what's going on? It's Dr. Ganatra, author of Reinventing Dentistry and creator of Dental Practice Mastery, where we teach you how to build, market, and grow your own practice. And in this video, I want to talk to you about how to have engaging conversations with your patients. You know, I'm sitting here in my practice here in Orange County, California, and I was thinking, through the course of the last 13 years, I've probably seen 50,000 appointments. You know, just a simple calculation, conservative calculation based on, 10 or 15 patients a day. And that equates to about 50,000 appointments, or you could say 50,000 conversations. And one of the biggest skills that I've always tried to develop, refine, and always consistently improve is the art of having a conversation. Because you cannot make an impact, you can't get your dental work done, you can't initiate treatment unless you know how to really have meaningful and engaging conversations with your patients. So in this video, I wanted to talk to you about how do we do that? How do we have engaging conversations with our patients? So there's a few things. I want to give you a framework for that. And the first thing in the framework is really to have this high level of good energy as you walk into the room. So when you walk into the room, you need to be in a good energetic state. Your aura, that people may say, or your energy or your vibrancy, or some people don't give off that certain energy that they probably ideally would want to give off. So you have to be mindful of where's your energy state. Where are you in the day? If you're feeling, lethargic, or you're just not feeling good, or you're down, you need to kind of refocus, get yourself back into the present, be mindful of where you're at, and really kind of zone in on all the thoughts that you're supposed to be having now and not be projecting forward or thinking about the past. Be here, be present, be in the moment. So get your energy back to where it is, where it should be now, beneath, above the ground right here, and just start feeling energetic. And when you walk into that room, kind of project that energy onto the patient. I'm not saying you walk in and you're crazy and you're just spazzing out, but you walk in and you're feeling vibrant, you're feeling happy, you're feeling, excited that they're in your practice. And one of the best ways to kind of exemplify this is through your tone. The tone of your voice says so much more than what you're actually saying. They've done studies on this. The thing that affects your communication the most is really your tone and your physiology. The verbal aspect of what you're actually saying is the least bit relevant in your communication. So in communication studies, we've seen that the verbal aspect is not as impactful or not as relevant as your tone and your physiology. So take control of that. When you walk into the room, be energetic, be in this peak state, be happy, be vibrant, be loose. Don't just be so rigid and stiff. Be okay and comfortable with seeing that patient and sincerely happy about it. And make sure you're using your tone effectively as you talk to them. That brings me to the next part. Ask questions. Ask your patients questions. That doesn't mean questions like, hey, when was your last dental treatment? Or which tooth is hurting, or do you floss? Not stuff like that. Those are just boring questions, right? Really ask questions that encourage them to bring their life's journey out. Where are they in their life? If they're going to school, hey, where are you going to school? Or if they answer back and they say, I'm going to school over here. Listen, stop. Don't just reply back with one of your answers, or don't just reply back with one of your own experiences. Listen to what they're saying. Take it in, process it, and just take it in. Be there and listen. Ask those questions. Ask the first level questions, and then as they answer those, ask them a second or third dimension question. So I'll give you an example. Someone says, I go to school over here down the street at this university or college. Then ask them, hey, what are you majoring in? Oh, that's great. Oh, what do you plan to do when you get out with that major? Is that something that you're looking forward to doing? How'd you kind of get into, thinking about doing that? These are all second or third tier questions. These are questions that kind of tell the patient, wow, this person's actually listening to my story. They're listening to my journey. They're listening, and they're here in my day. This really gets them to engage with you in that conversation. You're pitching and catching. But be mindful of the fact that, as soon as they answer that question, I'm kind of pointing here. There's a dental chair here if you haven't already noticed. But as soon as they answer that question, you want to just kind of be there. You don't want to just project your own experience on it. You don't want to say, oh, I went to that school, or my friend went to that school. Make it about them. Give them the platform to speak. If you let people talk about their life and their journey, if you give them that comfortability, they will. And as soon as people start talking about their life, their journey, and they feel understood by you, they're going to feel a lot more comfortable. So bring that out with them. Bring that out in them, right? So ask those questions, second or third dimension questions after the answer the first question. Ask a little bit more. And also learn the art of asking soft questions. What I mean by that is, let's take the flossing thing for example. If you're asking a patient, hey, do you floss? That's a pretty hard, direct question. Or, how often are you going to the dentist? That's a pretty hard, direct question. One way to rephrase that is, are you flossing as much as you want to be? That's a softer question. Most people are going to say what? No to that, right? So if I ask a softer question, I'm going to make that patient feel a little bit more comfortable with the answer if they think that answer is not ideal. They're going to be more okay answering that question, Sometimes we'll get kids in the office, 3, 4, 5, 6-year-old kids, and we'll ask them, hey, are you brushing as much as you want to brush? Or, the better thing that we usually ask is, hey, how's your brushing technique? Are you skipping any days? Do you ever skip a day? Do you get too busy? And believe it or not, a lot of them will say, yeah, actually I skip a day, or, I kind of got, sometimes I don't brush every day. But I give them that opportunity to say that by asking a softer question. If you're wondering whether that patient has been consistent with their dental appointments, are you coming into the dentist as much as you want to be? Is it a few times a year? If you ask a softer question, you're more likely to get a more honest answer, right? So ask softer questions, specifically when it comes to treatment, and make sure that you're comforting of those questions. Make it so they feel that it's okay if they're missing the mark, that they're not being perfect. That doesn't matter. That what matters is that they're here now. It doesn't matter if they're perfect or not. It matters that they're here now and that they're trying to make the attempt to take better care of their teeth, right? So ask soft questions, ask questions, second, third level questions that are questions on what they answered, right? And that brings me to the third thing, which is use the loop back around strategy. The loop back around strategy is essentially when they answer that question, I'm going to actually use the answer to some of those questions back in my conversation with them later. So if I'm working on their teeth or we're almost done, I'll just throw back in what they said about maybe their pet, or I'll throw back in what they said about maybe their summer, or if they're going skiing next winter, I'll say, wow, this is great. Your tooth's all set to go. Hopefully you won't be sensitive when you're out in the slopes next winter. Or, I'll say something like, well, summer's almost over. It's time to get back to school. I know you start in August. So I'll kind of interject and integrate some of the stuff that they told me about their life back into the conversation. So I'm taking their answers, integrating them, or looping them back into the conversation. That's what we call the loop back around strategy. And fourth, finally, leave the patient on a very vibrant, happy, forward-thinking, positive note. It's not just okay, we just got done, your tooth should be feeling good, it's fine. No. You know what? We just got done with treatment. Everything came out really well. Things are going to feel great. You may have some sensitivity. It's normal, but that's great that you came back in. Great that you kind of decided to get this done. It was really good that you did. And have a wonderful week, and we'll see you back in a couple weeks. Leave on a positive frame of reference, right? A positive frame of reference is also looping back something they told you and talking positively about what they just told you, right? So leave on a positive note. Kind of generally stated, but also use the loop background strategy when you integrate some of that piece of your conversation back into what you guys are talking about. So these are the 4 things. If you do them, if you keep your energy at a peak state, if you use your tone effectively, the tone of your voice is very effective at communicating what you want to communicate. If you ask the right questions, softer questions, not just hard, direct questions, and then you actually utilize those answers and you loop them back around and integrate them into the conversation. And finally, if you leave on a positive and a healthy and a vibrant and a forward-thinking and the best is yet to come type of tone, I guarantee you, your patients are more likely to get treatment done, sign up for even more treatment, and come back to your practice and be happy with what you're doing and be also confident in your ability to carve out that relationship with them. So try this out the next time you're in your practice, and I will see you in the next video.